So thank you everybody for taking time to be with us today. My name is Kyle Patterson and I'm from Bryson Insurance. We like to put on these learning opportunities for our clients and other people in the community. And today I'm very pleased and excited and grateful to be joined by both Ian Johncox and Stephanie Miner from Mason Bennett Johncox. Just before I hand the floor over to them, just to set us up here, we know that this topic in specific is sensitive in nature, but it is important. So vaccine and vaccine-related discussions can be quite heated and polarizing in nature. Even in this room, you could have two business owners with completely different perspectives of how they think vaccination policies should go in the workplace, whether they should even exist or not. So we are very aware that there's a wide breadth of view here. And we know at the end of the day that you, company business owners or HR professionals, are really just trying to ensure the well-being and safety and success of the variety of shareholders you have, most specifically clients and your team. And doing all that on top of ensuring that your business can survive and hopefully thrive into the future. So our intention today is simply to be of service to you, provide perspective and any kind of early learnings that's been discovered over time, answer questions that you have, and at the end of the day, help you make informed decisions that can positively impact your business strategy and where you want to go. So today, again, I shared that we're joined by Ian Johncox and Stephanie Miner from Mason Bennett Johncox. And just to give you a quick snippet of both of them, Stephanie practices civil litigation and employment law, and Ian Johncox specifically practices employment law, franchise litigation, contract litigation, and occupier liability defense. What I think is the most fantastic thing about Mason Bennett Johncox is that they are a local practice in Brooklyn. But as you can hear, even with what I've shared that they both practice, they are a very modern, forward-looking law firm in our nice community of Brooklyn, and they are neighbors of ours just down the road. So with that, I am going to hand the floor over to Ian just to kind of kick us off with some initial comments, and then Stephanie will go through a discussion, and then we'll do some Q&A. But my invitation is write all your questions in the chat, and we'll make sure to address them as we go at the end. Ian?
Great. Well, thanks very much, Kyle, and good morning, everyone. I just have a few opening comments before Stephanie heads up the formal presentation. And Stephanie has been kind enough to have done all the work to prepare for this presentation and to allow me to take some of the credit. So I thank her for that. So COVID-19 has been the biggest disruption in the employment sector since World War II. And our patchwork of employment law, which is various statutes, and the common law, which is decades of judge-made law, never contemplated a pandemic of this severity. And at the start of the pandemic, the situation was very fluid as various levels of government struggled to adapt to the rapidly changing situation. And we found ourselves giving advice to clients with a warning that the situation and our advice could change within days. And it did, and sometimes it changed within just hours. Now, at what we hope are the ending stages of this pandemic, we find ourselves in a similarly fluid situation when it comes to vaccine policies. And the law has never had to adapt as quickly as it has in the last 20 months. But that's what the law does. The law evolves. And as one court has said, that the law develops and innovative and novel legal arguments are made, and the law develops either gradually or in leaps and bounds. And these days, we're dealing with leaps and bounds. And every day, it seems we're hearing new developments in this particular area. Recent news headlines include YouTube announced that it was blocking and removing all anti-vax misinformation. The TTC accused its union of encouraging its members not to disclose their vaccination status. So the TTC then brought an application to the Labor Board claiming that the union's action amounted to an illegal strike. Tellingly, the same day, the union reversed course and is now encouraging its members to disclose their status. And I would ask, why did they cave so fast? And I think they knew that they were destined to lose and lose badly. In fact, the union then sought an injunction from the courts seeking to prevent the TTC from implementing its vaccine policy. and the court just recently denied that request. One of OPG's unions also sought an injunction preventing OPG from implementing its policy. That request was denied by the courts. The regulator for Alberta doctors is exploring ways to speed up its investigation into physicians accused of spreading misinformation or treating patients with unproven COVID remedies. The RCMP, their union, says it supports the right, as they call it, of RCMP officers to refuse to get vaccinated, and they will back up any member who refuses a vaccine once the mandatory vaccine policy is put in place for the federal public service. I say good luck with that. Thousands of healthcare workers in Quebec face suspension for refusing to be vaccinated against COVID. And nearly half of those unvaccinated employees are frontline workers in direct contact with patients. And recently, the Ontario College of Physicians and Surgeons has barred a family doctor from providing exemptions for COVID-19 vaccines and face masks, alleging that he has deliberately spread misinformation about the pandemic. The college says he is incompetent and that he is engaged in disgraceful and dishonorable conduct. So we're strongly being encouraged to develop vaccine policies. And what are those supposed to look like? Well, our answer would have looked a lot different 24 months ago. It would have looked different 10 weeks ago. And just a few weeks ago, the Human Rights Commission of Ontario said that refusing a vaccine for reasons of personal preference is a choice, not a right. There is no protection under the Human Rights Code for those people. In our opinion, the overriding principle is to keep focused on the big picture. This is a global pandemic that has been disastrous for our economy, for our environment, our physical health, and our mental health. Personal preferences that hinder the recovery are not going to be well received by the courts. So with that, I turn it over to Stephanie to speak about vaccine policies and her presentation.
Great, thanks, Ian. We'll jump into the more formal element of the presentation now. You should all see some slides on your screen. I've thrown up an agenda there to start. We'll begin by discussing a little bit about what your responsibilities and obligations are at law as an employer, as an owner of a business. The bulk of our presentation will then discuss vaccination policies for your workplace, and these are going to be applicable to your employees. Can you implement them? How to implement them? What they should include, etc. The tail end of the presentation, we'll spend a little bit of time then talking about vaccination and policies for customers or patrons, which are going to look a little bit different than vaccination policies for employees. And then finally, as Kyle and Ian have both mentioned, there will be a question and answer period at the end. So if you do have any questions, you can put them in the chat. You can hold them to the end, and we're happy to address any of those if we haven't answered them already. Okay, so to start, a little bit of a disclaimer here. This is echoing much of what Ian has stated, but it is important to note that regulations and recommendations pertaining to COVID are rapidly evolving, right? And because COVID presents new challenges for employers, for society, for lawyers, for the courts, there's very few legal precedents here. And we know that the law can be slow to evolve. And more we're seeing more case law come out. But the point here is that, our information today and the law is ever changing. So things will certainly require updating as we get a little bit more clarity. And I also wanted to note that the majority of our presentation today will address vaccination policies pertaining to employees in Ontario in non-unionized workplaces. Okay, so let's jump in here. What are an employer's obligations for COVID-19 vaccinations in the workplace? This is something that we certainly get a lot of phone calls and questions about at our office. And the starting point is going to be health and safety legislation. So in Ontario, that is the Occupational Health and Safety Act. I'm sure many of you are familiar with the Act as employers. And what that Act says, or one of the things that the Act says, is that employers are required to take every precaution reasonable in the circumstances for the protection of their workers. Now, when we're in a pandemic, that responsibility is, of course, going to extend to COVID-19. And that's what is going to allow employers to implement health and safety policies, not just about vaccines, but masking, distancing, etc. Whatever is necessary in their workplace to ensure the health and safety of their employees. I've also noted there additional provincial and regular and regional requirements. When businesses were allowed to open in stage 3, when Ontario moved into stage 3, that came with a requirement to ensure that businesses are operating in accordance with the recommendations of the various medical officers of health, whether that be regional, provincial, and majority of those officers are, of course, recommending a vaccination policies in the workplace. So the million-dollar question here, can an employer require mandatory vaccination? And if so, when? The short answer is yes, an employer can require mandatory vaccination. That again is going to stem from the requirements to comply with their obligations under the Occupational Health and Safety Act. The Ontario Human Rights Commission has also taken the position that workplace vaccination requirements are permissible, they are reasonable. There's always going to be some exemptions, particularly under the Human Rights Code, that employers will have to allow for. And we're going to get into those in a little bit more detail later in the presentation. From a management standpoint, I think it's also important to think about the message that having a vaccination policy sends to employers, whatever that vaccination policy may be, because it is going to look different for various workplaces. But you're sending a message to your employer or to your employees rather, that you are operating consistent with health and safety legislation. You are making your intentions clear. And on the flip side, if you don't have a vaccination policy, you don't want to assume that your employees know your position, right? So from a management standpoint, it does offer some clarity. Again, you're going to want to consider the context and circumstances, the sector that you're operating in when you're deciding on your policy and when to implement that. Of course, now we're seeing it more and more, policies being implemented into all sorts of workplaces, but higher risk workplaces where there's lots of employee interaction or interaction with customers have likely seen vaccination policies for a while. Perhaps your employees are still working from home and you're thinking about opening your office in the new year. That would then be a great time to establish a vaccination policy. So think of the context and think of what works for your workplace. Okay, so we've established where an employer's rights stem from in health and safety legislation. We've established that an employer can, in fact, have a vaccination policy and they can mandate that their employees be vaccinated. Then comes the question, what should a workplace vaccination policy include? You'll see on the slide there, I've noted that there is no one-size-fits-all policy. There's not a template that's going to work for all sorts of workplaces because, again, context matters. What is going to be uniform across workplaces, however, is that the policy should be in writing and it should be made accessible to employees. And this goes for all policies, right? Your employees need to be made aware of that policy, whether it's emailed out, whether it's posted around the workplace, and it should be easy to refer back to. Within the policy itself, you're going to want to consider addressing various factors. You'll see I put a list there on the slides. The first is context. This is your opportunity as an employer to reiterate your commitment really to health and safety in the workplace and why the policy is important. Communication with your employees and how the policy is presented matters, right? And that context piece up front in the policy is going to allow you to operate and smooth that transition in implementing the policy. Scope, who does the policy apply to? Is it all of your employees? Is it volunteers as well? Part-time, full-time contractors, any visitors into the office? You're going to want to contemplate what's best for your workplace. Definitions are a big one. I think it's easy to assume that everyone interprets a term the same way you do, right? Is fully vaccinated, having 2 vaccines, or is it going to encompass booster shots as they're recommended? So you're going to want to define terms. Valid proof. What is valid proof? Is that providing your QR code? Is it showing a copy of your Ontario Health vaccination receipt? So think about the terms that you're going to be using within the policy. Requirements, this is the substance of the policy. So what is it that you're actually requiring? Are you requiring all employees to be fully vaccinated? Are you requiring employees who are working in the office to be fully vaccinated? Is there leeway to do rapid testing if you're not fully vaccinated? So again, what's going to work in your workplace, you're going to want to lay that out. Verification would be the proof of vaccination. As I sort of mentioned, that's typically going to be the QR code or the official vaccination receipt from the Ontario Ministry of Health. Timeline. When are you going to implement the policy and when is it going to be effective? It's important to note that if you're advising employees of this policy and you're requiring employees to be vaccinated, you need to allow for that vaccination to happen, right? So you need to be reasonable with that. Provide the number of weeks so employees know when the policy comes into effect. Privacy is a big one, and we'll talk about this a little bit later in the presentation. But if you are collecting information from your employees as far as, whether they're vaccinated or not, maybe you have the receipt, their vaccination receipt, you will want to lay out how that's being used because that is understandably a concern, right? It should be confidential and retained by management of the company, and it's not going to be presented to customers, to the public, etc. Exemptions. There are going to be human rights exemptions, and again, we'll talk about this in a little bit more detail, but there's human rights exemptions that you will need to account for in the policy. You may also, as an employer, have some specific circumstances that you are providing some exemptions for outside of what is a protected ground under the code. Accommodation, again, we'll get into this further, but for those who are exempt under the Ontario Human Rights Code, they are entitled to accommodation. So you will want to lay out what that accommodation is. Maybe it allows them to work from home. Maybe they're having to submit bi-weekly or testing twice a week. Non-compliance, you will want to be clear if employees are not following your policy, what are the consequences? If you don't comply, are they being terminated? And again, we'll get into this in a little bit more detail. That's definitely a hot topic, but there shouldn't be surprises, right? Everything that the employee needs to know should be in that policy. And then I would also allow some room for updating. As we laid out at the beginning, this is an ever-changing landscape, right? So the policy may need to be updated, and it's likely going to be temporary, right? So put some language in there that just allows you as the employer to easily update the employee or the policy rather, as needed to comply with health and safety recommendations in your So let's move on. Exemptions. Are there exemptions for mandatory vaccination? If so, how should such exemptions be addressed? Under law, as I mentioned, there are protected grounds under the Ontario Human Rights Code that may lead to a vaccine exemption. The first one, and the main one really, is a medical exemption. Now, I'm not a doctor, but I am informed that the Ontario College of Physicians and Surgeons have received directive to not be providing exemptions loosely, and there are just limited factors that would allow for an exemption. The second exemption that's protected or ground protected under the code is the religious exemption. And this is an interesting one that we heard more about sort of at the beginning of the pandemic when the vaccines were first coming out. And, someone may state that their religion prevents them from being vaccinated. Now, it's important that to know that the code states that a religious exemption must be more than a personal belief. But interestingly, the Human Rights Commission has released a policy statement. I believe this is a couple months old now. It came out the end of September. And what it said is that it said even if a religious exemption may be met in its context, the risk of COVID-19 is likely going to outweigh that religious factor. So really where that leaves us is the only valid exemption under law is that medical exemption, okay? As an employer, you are entitled to evidence of that exemption. So for a medical exemption, that's going to be a valid doctor's note. And then it's your duty as the employer to accommodate up to the point of undue hardship. Now, this is going to be a conversation with the employee. Again, you can't accommodate if you're not aware of what needs to be accommodated. You're not aware of the exemption. So the employee would have the task of informing you of such. And then accommodation is going to look different depending on your workplace and depending on your employees. So some of the exemptions you may want to think about again is working from home if that's feasible. Frequent rapid testing, and if this is for a human rights protected exemption, it would be on the employer to pay for the cost of that testing. We've typically seen this be done twice a week in the workplace because the clearance is only valid up for, I believe, 2-3 days, and then they would need to be tested again. At the bottom of the slide there, I've referenced this Ontario Human Rights Commission policy statement. It is available on the Human Rights Commission website, and it is interesting if this is something that you're working with in your workplace. It is interesting to read the position of the Human Rights Commission on this and give some context as far as accommodation required by employers as well. Okay. We'll move on to non-compliance. This again is another another topic we get a lot of questions on, of course. How do you address employees who refuse vaccination, or assuming you're requiring vaccination, or they take issue with your vaccination policy? As I've repeated several times now, context, of course, is going to matter, right? You want to make sure your policy is reasonable for your workplace. You want to make sure it's communicated in a way to employees that they understand why it's necessary, right? That you're coming from a point of protecting your employees as a collective, and it really is a health and safety issue. If an employee is taking issue, you want to understand what the employee's objection is. Have a conversation with them, right? Have some dialogue. And it may be as simple as, there's some miscommunication, there's some misunderstanding, and it can solve there. If the employee does not have a substantiated exemption, So that would mean it's not an exemption under the Ontario Human Rights Code, and it's not any other exemption that you may have allowed for within your policy, then the employee is required to comply with the workplace policy, and it's absolutely reasonable to inform the employee of that. And that may be enough, right? That may be enough. The employee wants to keep their job, and therefore they'll comply with your requirements. If it's not, you'll want to consider what the possible repercussions and consequences for non-compliance may be. Now, this should already be in your policy laid out, right? So there's no confusion. It would be a series of discipline typically. Termination is the big one. When you terminate an employee, there's termination with cause or without cause. If you're terminating with cause, that means the employee is not entitled to notice or other termination entitlements. If you're terminating without cause, you are providing the employee ample notice and whatever entitlements may be required under law. Now, termination with cause for not complying with the vaccination policy may definitely be an option for an employer. I would recommend that you get some advice, some legal advice on that, because again, the law, we don't have a lot of precedent here in the law, and you want to make sure that it's carried out properly. But we've definitely seen it happen, and I think it's definitely an option. Some other more in between sort of options maybe, again, are you willing to accommodate in a different way? I've read a little bit about various leaves that the employee can go on. I mean, I think it gets a little gray, but it is context specific, and I would recommend getting some advice if you do get to this point. Okay. Privacy considerations. What are the relevant privacy considerations for vaccine policies? This is another hot topic. I think that understandably employees are a little bit concerned about their privacy if they're disclosing, various information to their employers about their vaccination status. So again, this should be laid out in your policy, right? What information are you requesting? Are you, now that we have the QR codes, it may be enough just to check the status of the vaccination status of your employee. You may not need to say, email me the formal receipt. You may choose to have them email you the formal receipt. And again, that's fine, but you want to be clear what is being requested, how it is being stored, who it's being disclosed to, and for what purpose, and what exactly is disclosed, general versus specific. So I'll give you an example. I have a couple of clients who are in the construction industry, and they deal a lot with subcontractors, and they've been asked for various projects that they're working on from their clients to give attestations that all of their employees or subcontractors attending the work site have been vaccinated. That would mean that the employer then has to go to their subcontractors and their employees and get confirmation from them that they are vaccinated. The employer then would go back to their client to give reassurance that yes, every employee who's attending the site is vaccinated. If one of those employees is not vaccinated, I would not recommend the employer say, Joe Smith is not vaccinated. Instead, the employer would have to remove that employee from the job site. So it's the generals versus specific. An employer can say all of my employees are vaccinated, but they're not going to say all of my employees are vaccinated except for these two specific individuals. Another thing that's come up is sometimes if an employee is not vaccinated and they're receiving accommodation, perhaps they're working from home when everyone else is in the workplace, other employees, of course, are going to perhaps realize that employee is not vaccinated. And that's fine, right? That's a reality that's going to be made. Where the problem would lie is if an employee came to the employer and said, Joe Smith at home is working from home. Is he not vaccinated? Then the employer's response would be, we don't discuss individual vaccination status of our employees with others. I think when it comes to privacy, being upfront in the policy, as I mentioned, it is going to be your best bet. Perhaps language stating vaccination status information will only be collected, used, and disclosed as required for the reasonable purpose of taking all reasonable precautions to ensure the health and safety of everyone in the workplace, administering this policy, and as required by law. Okay. So what I'd like to do now is just spend a couple of moments switching gears slightly, and this is to talk about vaccination policies for patrons. So how do you address vaccination policies for customers, clients, etc.? The responsibilities and requirements may be different for patrons than for employees, right? Now, there are specific government requirements I'm sure we're all aware of for certain sectors. Restaurants, bars, event spaces, sports and fitness facilities. They are required, of course, that their patrons be vaccinated. And the Ontario Ministry of Health has vaccination guidelines, a guidance document easily accessible online that outlines what all the requirements are there. This came into effect September 22nd. So everyone, if you're in that industry, should be pretty up to date there. What is a little bit more interesting, of course, is if you're a business that is in a different sector, a sector that's not mandated that all of their customers or attendees be vaccinated. What's your policy going to be? So you may still refuse entry to those unvaccinated. And you may not, right? Again, you're going to want to consider the context of your workplace. Alternative safety measures in lieu of refusing entry for those unvaccinated, maybe heightened distancing capacity measures. Whatever it is, you are going to want to have a policy in place. Again, it should be in writing, and your patrons should be aware of what that policy is. So our clients are aware, and if meetings are set up, what our expectations are emailed to those clients in advance. The policy is posted upon at the front door of our office, so everyone's made aware. Of course, as always, there may be some exemptions, and you are going to want to consider what the human rights exemptions are under the protected statutory grounds as well. So I am seeing a lot of questions come in here. So in interest of time, I may leave it there. I guess the difference of checking vaccination status between employees and patrons is there is the app for patrons coming in that you can have on your phone, so you're not collecting any information now that we have the more convenient QR codes. Okay, so to end the presentation, I'll just note that of course vaccination is a hot topic right now, and definitely something to put some thought to, but it is one of several health and safety measures that workplaces should be implementing to comply with their requirements under the Occupational Health and Safety Act. So distancing, masking, screening upon entry should work in conjunction with whatever vaccination policy you have implemented or are thinking about implementing.
Fantastic. Thank you, Stephanie. That was That was a fantastic overview. And just, I was kind of taking all the questions, trying to organize them. So you definitely generated a lot of conversation throughout that process there. Um, and if you're both ready, I can go through and ask some of the questions. I've tried to group some of them together that make sense to be asked in unison because some kind of fall in the same categories. Um, and maybe starting off with something sort of quick and maybe clear and easy. Do volunteers fall into that same category as employee, or how do you quantify employees volunteers in this?
Well, I think if you're looking at it from an employer perspective where you've got volunteers on site, again, having a policy is not a requirement under the law. It's just perhaps a very good idea to do. But I think your policy should address volunteers, and if volunteers are part of your organization, that you've got volunteers helping out, I think for the protection of your employees, that you should probably also be imposing the same policy on your volunteers. If they're coming into the building and interacting with your staff, for the protection of your staff, you probably want to have your policy apply to volunteers, and maybe the different provisions apply to the volunteers due to the paid staff. You may put some restrictions in place that prevent the volunteers from having access to all the building, for example. But I think it's something that you should address in your policy if you have volunteers on site.
Great. And if there's a policy in place and there's a group of employees or just even one employee, but they're actively, so if I get the one employee, this is two questions are kind of on this. But what if there's a group of employees actively verbalizing against the stance of a company or operating in opposition to the policy? Like, what should a company really do in that case? So more than one, because I get the one is something that's manageable potentially, but what if there's more than one?
Well, I think you got to look at this again from a broader perspective. If you had a policy dealing with harassment or privacy or other things, and you've got a lot of policies on, a lot of companies have policies addressing a lot of different things. You're entitled to make policies that affect your workplace, and if an employee is verbalizing against them, you're going to discipline them. You're going to talk to them. You're going to coach them. You're going to say, look, you're entitled to your opinion, but it's got to be kept quiet because that's inconsistent with our policy here. And if you act in a way that's inconsistent with our policies, it's going to get you in trouble and ultimately lead to losing your job. The strange thing here with the anti-vaxxers is that you've got a group that believes that this is a rights-based issue, and it's not. And they think that there's strength in numbers, which of course there is to some extent. But you start disciplining and firing one or two of those numbers, and the rest are going to either fall in line or follow along. But I think it's you've got to be quick and act against, take action against those people, so you can stop that. I don't want to call it gang mentality, but group mentality, where people think there's power in the group, and dissuade that before it gets too far.
Great, yeah, and I do hear then the opposite side of that challenge. We're in a difficult time to find good employees, and you can have good people who are opposed to vaccination. So I hear the challenge of that question too from that employer. There's a few here about privacy of information. So I'm going to maybe read one and try to weave the other ones in. And Stephanie, you covered off a bit of this, but what needs to be in place to protect the employee's personal medical information? Because previous to this, I mean, you got, group benefits in some aspects of some personal information of people, but for the most part, employers are not collecting medical information like this. So what has to be in place to protect that information?
Well, I think there's various levels of information you might choose to keep, and then of course there's going to be various levels of responsibility upon you. So it may be that your policy, how you implement this policy, is that someone or some people are in charge of looking at the vaccine receipt or of the employee and not taking a copy of it. And they're going to mark down, yes, I looked at it and I saw it. And so you've got a log of who you've seen the policy, the vaccine receipt from, but you haven't actually taken a copy. So you're not retaining any medical information at that point. Of course, if you're worried about proving it and you want to maintain a copy of the receipt, well, then, you're dealing with medical information just like you would be on a benefits. If someone submits benefits, receipts for prescriptions, for example, well, you've got to keep that, you've got to keep that information confidential, and then treat this in the same way. If you've got people's personnel files that have confidential medical information, you've got to treat this the same way and treat it confidentially, and try to prevent access from people that shouldn't have access to it.
Yeah, and I think that you kind of answered that second kind of question that falls in this too, around what if there is a breach, but it's no different than if somebody in HR was breaching the information of someone's health information to do with their own medical history with benefits. So I get that would fall under that same category. And then, with these screeners that businesses have for employees and clients, but this question is about the employees. It asks those COVID-related questions, and so the two questions is: to what degree is that information confidential? Like who has access or who can access that information? And what if the employer finds out that an employee lied on those questions? Like, to what degree does that? What kind of follows up from there?
Well, I think you've got to look at that from two perspectives. One, if an employee is lying on the screening questions and say is not disclosing that they've been in contact with someone or something like that, well, now they're putting other employees at risk and lying about it. So you're going to take action against them. Lying in itself, dishonesty, is grounds for discipline, ultimately leading to termination for cause. Trust and honesty is a critical part of any employment relationship. And if employees are doing things to erode or ultimately destroy that trust, they're going to end up losing their jobs.
That's fair. And I muted myself there because the helicopter was flying like super low over my house. They talk. So the question about it comes back to bullying and discrimination around the vaccine status, and you talked around the policy from the public, but what about colleagues? So I guess the concern is if some colleagues find out that somebody or a group of people are not vaccinated, or I guess even if they find out the group is vaccinated and they're on the other side, and there's some bullying and discrimination going on. I get the echo of your response here from previous responses. But what should be put in there, and should that actually be in the policy? Some bullying and discrimination language?
I don't think it's necessary if you already have a policy on discrimination and harassment, because it's going to be taken in by that policy. So You don't want to be repeating policies within other policies. It's not necessary. And you would treat that bullying and harassment, discrimination, the same way you would any other.
Okay. Two sides of this same question around not wanting a vaccination policy or not needing it and thinking it may be necessary. So if you have a workforce that's all home or remote, do you need to have a vaccination policy, or even if it's mostly remote, does it need to exist?
You don't need to have it, but it's, again, not a bad idea to think about it. So, was your workplace always remote, or was it? Did it become remote during the pandemic, and you're expecting it to come back to the office? It may be that because most people are remote, your policy is a lot simpler and shorter than everyone else's. Is your workplace entirely remote? No one ever sees each other? Well, then maybe you don't need a policy at all. But I'd be surprised if there's workplaces where no one sees each other, no one sees clients. There's probably a need for some sort of policy. And again, as Stephanie said in her presentation, what's required in your policy is very context specific. You draft the policy to suit your own needs and your own requirements.
Okay, great. And then what if you are an employer who with people in the office who maybe just doesn't believe in having a vaccination policy? Like they don't have the desire to create that policy may be of that. I'm trying to read into the question, but just may not believe in the vaccination policy in general, maybe not even believing, that it's necessary to be vaccinated. So what if you're an employer who has that stance?
Well, I think again, you've got to be careful about that, because if your own personal stance is overridden by the Occupational Health and Safety Act, for example. So you may have a personal opinion that, hey, I don't really care about fall arrest prevention, policies and things like that. But maybe you're required to have them under the Ministry of Labor. Maybe you don't really care about racial discrimination, but you better make sure your workplace isn't one that is discriminatory. So even if you don't think that you may not think COVID is real, you may think the whole thing is a conspiracy. You may think that this whole vaccine stuff is going overboard and really not necessary. I don't want to do it. I don't care. You've got to be looking after your employees. So do you want to be in a situation where an employee gets sick and then turns on you and says, well, you didn't have a policy in place to help prevent this. I'm going to hold you accountable. You don't want that. So even though you may not believe that it's appropriate, you may not believe it's necessary, if you've got employees that ultimately might turn to you on a liability scenario, and believe me, they will, when personal injury lawyers are throwing darts at the target, they want that target to be as big as possible, and they're looking for as many possible defendants as they can. So if you are the employer that doesn't have a policy and they got sick at work, you're going to get targeted. So think of it as simple self-preservation.
And that's great, and that's a clear answer. And then there is a question on that other side. So if that vaccination policy does exist, an employee verbalizes they don't believe in the vaccination or whatever the story is there, and they do get vaccinated and they do get injured or worse, what's the requirement, what's the liability there on the employer?
That's a very interesting question. And in fact, I've been answering a question this morning from someone who went to another one of our presentations on the same point. What happens if someone has an adverse reaction to the vaccine? That's what you're talking about, right, Kyle?
Yeah, exactly. Yeah.
I think that when we look at these, the Occupational Health and Safety Act, for example, they're not seeking to attain perfection, and preventative measures under occupational health and safety are often not perfect. But what you're trying to do is significantly reduce the risk of illness or injury to your employees. And all you have to do is look at this from a statistical point of view. There are I checked this morning, over 5 million dead worldwide from COVID. How many are dead from the vaccine? It's statistically insignificant. There are over 250 million people that got sick from COVID. How many people got sick from the vaccine? Statistically insignificant. So it is better to have those measures in place and prevent the greater odds from happening. And there is a risk that someone might have an adverse reaction, but I don't think there's going to be liability on the employee, because our system of law does not allow you to be damned if you do, damned if you don't. So if you're going to be damned if you don't have a policy, or if you don't get people vaccinated, you're not going to be damned if you get people vaccinated. It's one or the other.
Thank you. And there is there's a perspective in this chat, but I think it's just about that you can't prove somebody got COVID or something sick at work versus somewhere else per se. But Ian, you can tell me if I'm wrong in this case, but Ian was talking about personal injury lawyers are seeking those as many sort of angles as possible, and it would still be a potential attack source. Is that correct, Ian? Like, it's hard to prove the source of the infection or COVID, but personal injury lawyers are still having their sights set everywhere they can.
Yeah, I you still might get sued if someone, gets sick from the vaccine. I don't think you're going to get successfully sued, but someone might try.
Right.
I
So I
just
think
don't
that's the
think.
distinction there. I think that resolves, sort of clears up what you were saying. There's a question here, and you might not know the case. Maybe you do. In New Brunswick, there was the workers' board made a judgment that I guess there were some people staying home for unpaid leave, and the workers' board deemed that not legal and ordered those either to go back to work or to be dismissed from work. Do you know about this case? And if you don't, it's fine. I can connect you after to provide context.
I don't know the case, but there's no right to unpaid leave if you don't want to get vaccinated either. The what it comes down to is we have choices in life, and choices have consequences. And one of the things I was writing this morning is you could, and there are risks. So if you were being advised that, hey, maybe you need a knee or a hip replacement, you're going to be advised by your doctor, hey, there's a small risk that this operation could go badly, and you could be in a worse situation than you were going into the operation. It's a very small risk, though. The odds are, though, that your life is going to be better as a result of the operation. And people choose to have those operations every day. And the person that says, no, I don't accept that small amount of risk, I'm going to go to continue my life in pain, discomfort, and with a loss of mobility. Well, that's a choice, but there are consequences. You might continue to live in misery then by not taking on that small risk of an adverse event with the operation. Well, the same thing for vaccines. You may choose, I'm not going to get a vaccine. Well, okay, those choices have consequences. You're going to find it hard to go to a restaurant. You're going to find it hard to travel. You're going to find it hard to do a lot of things. In fact, you might find it hard to continue to have your own job. But those are the consequences. So you have a choice to make. And it is a choice. And sometimes the consequences are not at all palatable, but it is a choice.
Right. And then on that flip side to that, if you had a workforce that was fully vaccinated, everything was clean, and maybe it's a small enough workforce that it fits within guidelines for the province and whatnot, are you able to remove things like masks and social distancing from a policy?
I sure hope so,
Okay.
as things improve. What I would like to see is that, and I can't wait for it myself to stop wearing a mask around the office, but I'm hoping that as the number of people vaccinated continues to rise, and we're going to see a significant jump starting this week with kids 5 to 11 being eligible to get the vaccine. So now again, as the more people you get vaccinated, the lesser the risk of transmission and serious events. So I'm very hopeful that as we see the numbers of vaccinations get higher and higher and higher, that the restrictions will get loosened more and more, and that will ultimately lead to no masks required and this vaccination policy may still exist, but be more in the back burner, like some other policies tend to be from time to time. But that's my hope, and it's all going to depend, I think, on the vaccine uptake.
Right. Okay. So there's not, I mean, you wouldn't recommend that gets removed from a policy at this point.
Well, right now, I think you've got a requirement to be wearing masks in certain
Okay.
contexts. So there's a requirement from your local boards, your local medical officer of health. There's provincial requirements, and you've got to follow those. So if the local medical officer of health still requires you to be wearing a mask, and I think that's a provincial requirement right now anyway, that's what you got to do, and you can't take it out of your policy until it's removed at a higher level.
Of course. Okay. And then as we move into the future, and this is a good question, but it's probably too early to kind of sort of state it. But as Ontario proceeds forward, and we hope that it continues to move in this direction where, Ontario is lifting restrictions, at what point do you think it's fine to remove the vaccine policy?
To remove it entirely?
Yeah, to just say this is no longer something that, with new hires that we're checking and just not make it part of the I'm guessing it's too early to probably answer this question, but like I guess what would be the sign that you could say, I don't need to do this anymore with let's say hiring new employees. Because that would be part of the onboarding of a new team member, for example.
I don't know if it'll ever change. You know, and I say that for a couple of reasons. One is that unless you eradicated COVID and its variants from the globe, there's still an element of risk there. Two is that we've seen just how disastrous it can be when a new virus comes up like this, and how much it can disrupt the world. So it may be that you just keep a policy in place that you might add a new virus to your policy down the road, but it may be that you do require it on an ongoing basis. And I've heard people talk of, well, what about the flu? Are we going to start mandating that people have flu vaccines? That's a different question, because you're talking about a disease that is less, in a lot of ways less disruptive than COVID. But I think that we're going to be so hyper vigilant about this that these policies are going to be in place for a long time.
Okay. Before we wrap up, I'm just seeing, before we wrap up, I'm just seeing if you have any final points. I see some people still typing, but what I've seen kind of come through in the chat is really seeing that sensitive nature to the discussion. So I do appreciate both of you coming and providing that legal perspective, your oversight, your current experience from what you've seen and what you've read. Is there anything final you'd like to say? Any final words before I go into the wrap up here?
Again, I think you really have to look at the big picture, and the big picture is that you're trying to prevent harm on a grand scale, and statistically that might involve a little bit of harm on a small scale. Those decisions are made at all levels of government all of the time, whether it be efficiency or cost or whatever those arguments are made. But you have to look at the bigger picture. And there was a really interesting comment I saw the other day at the end of a newscast, and it talked about the people that signed up for the two world wars, and that a lot of people, in the one war they were talking about specifically, that most of the people were not conscripted but signed up voluntarily to put their lives at risk for the greater good and to take risks for the greater good. And that's what we're looking at here. Is we're looking at, on a global scale, we've got a global effort here, which makes it a whole lot more nobler than a war, where you've got some people fighting against each other. You've got the species fighting against a virus, and a global effort's being put forth to decrease the effect of this virus and to reduce the amounts of death and illness. And everyone's expected to do their part. The statement, we're all in this together, means a whole lot when it comes to vaccines and prevention. We all need to give up a little bit and compromise a little bit for the greater good.
Okay, and there is a couple of questions still trickling through, but I think with this, because some of them are a bit more complicated and potentially in depth, I can connect you with the individual. I'll reach out to the individuals first, and you can let me know if you'd like to be connected with Stephanie and Ian to have that question addressed. And on that, as you can see, Ian and Stephanie are very generous and great local partners. You can see their email addresses here. I'll make sure they're also sent out to everybody as well. But they are here to provide this guidance, oversight, and again, there is no perfect answer right now. So I acknowledge both of you for being willing to come out and speak, your current reality from everything you know and everything you've learned and gained, and your generosity in sharing it with our clients, and making it very clear, I think, in a lot of more confusing or conflicted areas. So just thank you both for your time today. And thank you everybody for the lively conversation throughout. It was a real pleasure. So take care and have a great rest of your day.
Thank you, everyone.